Welcome back to Ethnic Health America. In this segment, our special guest is Dr. Godfrey Nunoo. He is a chiropractor. I want to talk to him about his specialty, the kinds of things that he treats and the ways in which he goes about healing. So, Dr. Nunoo, thank you for joining us.
It's my pleasure to be here.
Tell us about your journey to chiropractic.
Incidentally, I had a rather rough journey into chiropractic. I played rugby in college and consequently suffered some banging up of my spine. And eventually, after staying in class and not concentrating and focusing on my studies, I was referred to a guy named Dr. Boyd. He was an old, about 70-year-old chiropractor. And within 2 to 3 weeks, I would say no more than a month, I was back playing and just really enjoying a very vital lifestyle.
Getting right in that scrum, huh?
Yes, yes, scrum down.
What was your training like to become a chiropractor?
It was quite extensive. We had 4 years of rigorous didactic and clinical studies, of course, and primarily the 3 years was mostly in class and hands-on, and a whole year of just hands-on practice in the clinical setting, where we learned to adjust. In classes, we learned to adjust each other and just basically learn to touch the spine and be able to assess any disorders that might be in the spine with your fingertips.
What is the philosophy of chiropractic?
Chiropractic is the most largest non-drug profession that there is. And we deal primarily with wellness and, of course, the spine and the nerves. And we do not in any way use medications or drugs. However, that does not delineate the fact that in our practice, we do refer out to medical doctors and certainly to other areas of the sciences for evaluations and also treatments.
But you look at wellness differently. You look at wellness in terms of the spine.
Absolutely. We look at wellness from a different eye. And what we do actually is that in terms of where we begin, we center our primary interest on the spine itself and any disorders that would affect the spine. And if it affects the nervous system, it certainly affects every tissue there is in the body, from the eye blinking of your eye to every breath that you take.
So every body function can be seen in terms of its relationship to the spine.
Absolutely.
What are the common conditions that you treat?
Commonly, people come to us for a variety of ailments, and it's so wide range that it varies as much as the variations in the nervous system itself. So we see headache patients come in. We see patients who are coming in from trauma, such as back pain, neck pain, joint pain of any kind. So there's quite a variety of things that we tend to confront in our practice. And I would say, in order to make a percentage-wise, it's difficult to say exactly how many percent is backaches, but we are known primarily for backaches.
Now, when you touch the spine, you obviously sense more than I would sense. What are you looking for as you manipulate the spine? What are you in terms of feeling? What are you feeling for?
Essentially, you're feeling for the spine itself to see the differences between a proper spine and a spine that has some disorder. Patients will tell you, I have pain here or I have pain there. And of course, just like any other physician or doctor, we would do a consultation, we will do an examination, we will do basically history of the patient, and then of course we'll send them out in cases where there's trauma involved, definitely for an x-ray. And then of course some lab work where it's indicated. So these are the things that we can use to make our diagnosis more proper segment.
So the spine is you have here
down, and down the entire spectrum of it.
Is a collection of organized.
Well, you have 30 nerves, pairs of nerves, and if in any way you have any form of inhibition from pressure on any of those nerves, you begin to have pain, and it manifests itself in various degrees. And so that's really what brings the patients into the office.
So when you manipulate a patient, you're actually trying to do what?
We try to release the nerve centers so that they will have ease and freely touch the tissues, because ultimately the nervous system goes directly to the tissues of the body, the living tissues. And so when we release this stress on the nerve, then there is a clear channel to the tissues, and they release the tissues because it nourished them with the nerve centers.
Chiropractic is it's not an ancient art. It's about 100 some odd years old, right? But
More appropriately, more like 300.
300 years
yeah,
old.
about 300 years.
Are there different types of chiropractors? We've heard of neurochiropractors and sports chiropractors, and some that take on conditions beyond muscles like ADD and attention deficit disorder. And what is is that really the full range of the chiropractic?
It's wide. In fact, we have, like you mentioned, we have doctors who specialize in sports chiropractic, others who would specialize in areas to do with children who may have some specific issues in terms of maybe any injection even that they might have had that is causing them different ADDs and things like that. And they will deal with them. They will adjust their cranium, the skull itself. And so there's a variety, yes, of doctors that perform different areas.
What can you do as a chiropractor now that you couldn't do 10 years ago in terms of technology or advances in the specialty?
Well, technology has allowed us to go into a lot of modalities that really enhance our practice. There's various tables that have been designed with technology in mind that allow us to basically not use so much of our body when we adjust. They're practically adjusting guns, we call them, activators that we use to adjust the spine. So there's quite a bit of relief from the old school. And of course, the old school back in the early days, they were called bone setters because that's what they did. They primarily brought to bear force on the spine in various ways, of course, but to be able to align the spine, because when the alignment of the spine is proper, everything functions in terms of the tissues and the nerves properly in the spine.
Well, Dr. Godfrey Nunoo, thank
Yes.
you for taking the time to join us and explaining to our audience about chiropractic.
Yes, it's been my delight.
All right, thank you for watching this edition of Ethnic Health America. Remember, health is your biggest asset. I'm Dr. Michael Noor. We'll talk again.